Hello, practical nursing students. This is Darlene Lepresto, nursing instructor. With this video, I just want to show you some different types of medications and different routes of medications that might be ordered for your patient. And you will be doing lots of hands-on with your medications when we practice in class. I'm going to start here. And this is called a punch pack. And you will see these usually in the nursing homes. And they're filled for 30 days. And as you can see, they've started punching them out. So they always start at 31 and then they work back to number 1. And these are unit dose, so normally what's ever in the plastic wrap is what the dose is for the patient, but you always, at the top, it'll have their name and date of birth, the name of the medication, and sometimes there'll even be 2 pills in there. It just depends on the dose for the patient and then how big those pills are. Sometimes they can't get 2 in there, but you will see these a lot in the nursing homes, not so much in the hospitals. Here we have a couple different type of inhalers. We have an Advair disc inhaler, and then we have an Atrovent inhaler. I don't have a spacer to show you. This is a old-fashioned type of medication crushing. They've got the newer ones now, but the lid just unscrews, and then you put the medication in there, and then you screw the lid down and it crushes the medication. So you have to know if you can crush that certain med or not. You'd have to look it up. Here are some insulin, and we're going to practice drawing up insulin. Those come in a vial. Here we have milk of magnesia, which is our example of a medication that comes in a cup already pre-measured. You just take the lid off, verify the dose, again, and the name for the patient, all those different rights of medications, and they can drink it right out of the cup. Down here we have nitro ointment. Hard to believe it, we still use nitro paste, it's called. And you put it on a piece of paper, and they usually order it in 1-inch or 2-inch, and then you tape the paper. You put this on it just like you were putting on toothpaste, and then you put the paper on the patient's skin and tape it in place, rotate sites. This is an ophthalmic ointment. Okay. Here we have nitroglycerin sublingual. Notice that it's a little brown bottle because this medication is photosensitive, so it has to stay in this little brown bottle. They don't want to take it out and put it in with their other medications because this nitro will leach into the other medication. So that needs to keep separate. Here's ophthalmic drops. Here we have a type of ampule where the medication, this is Cymedrol as our example, but in the bottom is the medication and it's powdered. In the top is the liquid. And to engage this, you push the top, this red part, down. You squeeze really hard, and see that gray plunger? That will end up in the bottom, and it'll allow the liquid to mix with the powder, and you shake it up really good till it dissolves, and then take a needle and draw out the medication. That medication, for whatever reason, isn't stable, pre-mixed, so it has to come separated, and then we have to reconstitute it right before we give it. This is bacteriostatic 0.9% normal saline. We're going to use that a lot. These are 2 examples of insulin syringes. You'll see all different types of insulin syringes, especially again in the nursing homes. This is a medication ampule, and you're going to get a chance to work with these in class, and it's glass. And certain medications you can't put in plastic. And also notice it's brown, so it's photosensitive. And so we have to break the vial open, and I'll show you how to do that in class. It's scored right there at the neck. And then we use a filtered needle to take the medication out of the vial, and then we change the needle, and then we inject the patient. Just have to be careful with those glass shards. Now this instrument is called a Carpuject. This plastic instrument, so don't throw this away. This is reusable. Usually every nurse is carrying one around on the floor because medications come pre-filled. So this is a pre-filled syringe of hydrocodone. And these are locked up in the NARC cart, so you would sign it out just like you would any other narcotic. And then you place it in the carp eject. And I don't know if I can do this one-handed. But you lock it in place by twisting this blue cap. So you turn it counterclockwise, that locks it into place. And then you screw the plunger into the bottom of the vial, and then you're ready to give the injection. And it'll have a little air in it, so you have to push the air out. These are just different sizes of syringes. You're going to have to get to know your different sizes. This is a 3 ml syringe, and all the needles can be different as well. This is a tuberculin syringe. This is an insulin syringe. You can tell because it's orange on top, and they're very small, the doses. This is another 3 ml syringe, but it comes with a needle already, which is nice. So the syringes are packaged in lots and lots of different ways. And then last but not least, again, some more pre-filled syringes. This is Narcan. And so you have to engage it, and then it's given intranasally. This is heparin. So this is a blood thinner that we would put through an IV to keep the IV patent. And notice it already comes pre-filled. So all you do is put a needle on it, unless it's a needleless system. And then otherwise you just, it has a luer lock end on it, and you attach it to the IV and flush that IV. When we're in class, you're going to get a baggie full of goodies to do all different kinds of IM sub-Q injections. And this is an example of an injection pad that we have. Last, I want to show you the different types of syringes. Again, this might be hard to see because of the glass reflecting, but we'll have this out in class. And again, you're going to have to start learning the different size needles and then how to read them. So we have 3 cc, 5 cc, 10 cc, 20 cc. Caution, we have insulin syringes again, tuberculin syringe. Safety devices, all needles have to have some sort of safety device on them now. That's per national safety standards of the Joint Commission. And then these are the different size needles. So the higher the number, the smaller the needle. Higher the number, the smaller the needle. So look how teeny that 27 gauge is. And then we go up. And they come in all different lengths. But the size is the size of the actual needle itself. The smaller the gauge, or the bigger the gauge, the smaller the needle. So there's an 18, and that's a pretty big needle compared to the 27 that we looked down here. 27 is really small. And again, you'll be working with all of these in class.